It was announced yesterday that Zack Wheeler will be having surgery to resolve the compression from thoracic outlet syndrome in his throwing arm. Let's talk a little bit more about this. As you may know, he did have a blood clot in his throwing arm last week, and it was removed Monday, August 18th. However, following secondary opinions and evaluations, it was revealed that he did have thoracic outlet syndrome in his right arm. The thoracic outlet is an area between your collarbone and your first rib in which a bundle of nerves, an artery, and a vein run between. And 90% of the time, that bundle of nerves is what is affected. However, Zack Wheeler is in that 5 to 10% that did have his subclavian vein compressed, hence the blood clot. This article by Fangraphs actually features a chart of many pitchers who received thoracic outlet surgery and highlights their innings and ERAs and other stats before and after the surgery. Most of these guys did have neurogenic surgery. It's not really great to compare, but generally mixed outcomes with the surgery. I will, however, focus my attention to Merrill Kelly, who did get a thoracic outlet surgery for vascular thoracic outlet syndrome back in 2020. As I mentioned before, slightly different recovery with this vascular surgery, as you're much less likely to have nerve damage following this surgery. And it's not to say that it's a simple surgery by any means. It's a very similar surgery. You're removing the first rib and in most cases reattaching some of the muscles in your neck. A great beam of hope really for Zack Wheeler is that Merrill Kelly, after the vascular thoracic outlet syndrome following surgery, has been a great pitcher. He's pitched a lot of innings. This year is actually 14th innings pitched. He's pitched in a World Baseball Classic, pitched in a World Series, carries a 3.63 ERA since he had the surgery. However, age is going to play a massive role. He's already 35 years old. Not to mention the fact that he already has talked about retiring at the end of his contract, which will be after the 2027 season. That's not to say that he absolutely 100% will stick to those plans to retire after his contract, but it's something to think about. Patience, he probably misses anywhere from really 0 to maybe even 2 months of the regular season next year. With complications, he may miss about half or even more than half of next year. And there is no crystal ball to show how we pitch. Like I said, it is such a mixed bag. Some guys never come back from the same. Some guys pitch just as well or even better than they did before, like Merrill Kelly. Overall, this is a massive blow to the league's biggest workhorse in the past 5 to 10 years.